Now I'm just taking a picture around. Okay. Where's the charger? Okay, so I'm doing a head to assessment, and I'm going to wash my hand, clean my stethoscope, and put on the gloves. Okay. So hi, I'm Jane, a student Seneca from student RPN student from Seneca, and I'm doing a head to toe assessment, and it takes 30 minutes. So would you like to go to the washroom before we start?
No.
Okay. And this one involved me touching you, so so are you okay with that?
Yes.
Okay, and can I check your armband, please? Thank you. And just make sure that you're comfortable, and I'm going to close the curtain for privacy. So before we are going to start, I am going to ask you 3 questions. You're taking medication?
No.
Any allergy?
No.
Any pain?
No.
Okay, thank you. So now Janelle is Asian. Her color is brown, and she appears to be same age as stated, and she no odor, and body structure is normal, no involuntary movement, no physical deformities. She looks healthy, no signs of obesity, and maintain eye contact, and well dressed to appropriate weather. Um, she looks relaxed, no signs of obesity, no signs of distress, and the speech is clear. So now I'm going to check your mobility. So if you can walk from here to here and back, and mobility is balanced, gait is balanced. And now I'm going to check the level of consciousness. So can you tell me your complete name and date of birth?
Junior Gable, May 30, 2003.
Okay, client is alert and oriented times 3. So I'm going to check your breathing, and breathing is no signs of difficulty of breathing. So now I'm going to inspect your head. Head is round and symmetrical to the body, and I'm going to palpate and let me know if there's any pain.
No.
Any pain in here?
No.
Okay, so no pain, no lumps and bumps, no swelling. Scalp is smooth, and here is evenly distributed, and here is black, and no infestation of lice. And now I'm going to test a cranial. Now I'm going to test the cranial nerve 11 facial. So if you can smile, can you frown, and show me your teeth. Okay, lift your eyebrows. Okay, and shut your eyes tight. Okay, and puff up your cheek. Okay, no nerve damage, and face is symmetrical. So now I'm going to inspect your eyes. So eyelashes and eyebrow is evenly distributed, and eyelid met when the client closed her eyes. And now I'm going to check your sclera. So if you can tilt your head a little bit, and okay. I'm going to touch your eye. Sclera is white, conjunctiva is pink. So now I'm going to check the cranial nerve, which is ocular motor, and I'm putting a light in your eyes. So another one, I'm going to check your pupil. Pupil is equal and round. So I'm going to check your I'm going to check the that's so um, the direct and consensual reflect. If you, so I'm going to put again another light in your ears, in your eyes, and I will check if the other one is constricted. Okay, the consensual light. Okay, one the right eyes is constricted, so I'm going to do the other one. Okay, eyes is constricted. So now I'm going to check the accommodation. So if you look up straight, and I'm putting this one near to your eyes. Okay, both eyes is constricted, and now I'm going to check the accommodation. So if you look straight again, and don't oh, I think that's the accommodation. That's the accommodation. Okay, that's the accommodation that I just checked. So now I'm going to check check the the gaze. So I'm going to put this near your eye, and don't move your head. Just follow the pen with your eyes. Okay. So gaze is normal, no is nystagmus. So pupil is equal, round, uh, it's reactive to light, size 4, and accommodation. So now I'm going to check the cranial nerve. What's the next? Cranial nerve 2, which is the confrontational test. So if you cover your eyes, your other eye, and tell me if you are seeing double vision.
No. 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 No.
Okay, yeah, and we are going to do the same eye.
No. 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 No.
Okay, thank you. And now we are going to use the Snellen chart. So since my client is adult, or pretend you are older 45, so you are going to use this one, and you are going to hold and cover your one eye, and you hold it and read me which one you are that's the one that you can read.
9, 5 until 4, 3, 8, 7, 3, 9.
4, 3, 8. Okay, do the same the other one.
4, 2, 6, 7, 3, 9.
Okay, so your eyes is do you wear glasses?
No.
Okay, thank you. And your eyes is 20/20. So now I'm going to check your ears. So I'm going to inspect your ears. Okay, pinea is intact and no discharge. And I'm going to palpate. So let me know if there's any pain. And the auricle,
No.
no pain.
No.
I'm going to palpate your tragus.
No.
Is there any pain? Okay. No pain. And now I'm going to put a light. I'm going to put a light in your ears. So since my client is adult, so I'm going to check the. I'm going to pull the pinna up and back. So I'm going to check your extra auditory canal. Okay, pull pinna up and back, and okay, auditory canal is clear and no discharge. Tympanic membrane is grayish and shiny, and I'll do that the same one on the other ear. So it's the same now. So I'm going to uh, okay, palpate. I'm going to palpate your sinus and let me know if there is any pain. Okay, so I'm going to palpate. Is there any pain?
No.
Is there any? I'm going to palpate your maxillary sinus. Is there any pain?
No.
Okay, thank you. Now I'm going to check your let's see, cranial nerve 8. So I'm going to I'm going to tell you 3 words and repeat after me. Okay. 1,
1, 2, 3. A, B, Z.
2. Okay. Both ears can hear. So now I'm going to I'm going to check your cranial nerve 8, which is the Weber test, and tell me if you can hear on both ears.
Yeah.
Okay. You can hear on both ears.
Yes.
Okay. And I'm going to put this one in your mastoid and say now if you stop hearing.
Stop.
Okay. See now if you say stop hearing.
Stop.
Okay. So bone and air conduction is the same, and I'm going to do that with the other ear. But for now, I'm just that one can be done on both. So now I'm going to inspect your nose. So your nose is midline, and if you can tilt your head, so I'm going to check the tilt your head. So I'm going to check inside, no discharge, and pink inside. Okay, so now I'm going to check the cranial nerve 1, which is the patency of smell. So I'm going to close your eyes and let me know what you smell.
Vicks.
Okay, thank you. And same with the other one.
Coffee.
Okay, thank you. So both nose can smell. So now I'm going to I'm going to check on your mouth. So I'm going to inspect your mouth. Right, and so if you can show me your the lips, no fissures and no swelling, no fissures, no swelling. Gums is pink and no bleeding. Teeth is white and all present. And show me your tongue and the base, in the base. Okay. It's pink and no scars, no. And now I'm going to check the hard palate. A hard palate. Hard palate is whitish and the soft palate is pink, and it's intact. Now I'm going to inspect the cranial nerve 9 and cranial nerve 10, which is glossopharyngeal in vagus. So if you say uvula is rising and soft palate is moving. Okay, and now I'm going to check on the cranial nerve cranial nerve 12, the hypoglossal. So if you can stick your tongue and move from side to side. Tongue is moved from side to side, and can you say light, tight, dynamite? Okay, so the tongue is midline, and can move from side to side. So now I'm going to check to inspect your neck. So if neck is straight and no deformities, and I'm going to palpate your trachea. Trachea is straight in midline, and I'm going to show like bulging of thyroid, and now I'm going to palpitate your carotid pulse. Okay, so okay, it is the rhythm is regular, pulse is strong, and I'm going to do the same one. Okay, it's the same one. So okay, so that's no obvious of large enlargement of thyroid, so it's good. So now I'm going to test the cranial nerve 11, which is the is spinal accessory. So can you rotate your head and against the pressure? So can you rotate, and I'm going to put okay the other side. Okay, can rotate the head with against the pressure. So I'm going to put my hands, if you shrug your shoulder, and I'm going to put my hands on top of your shoulder. Okay, client can shrug her shoulder against the pressure, and now I'm going to check your integumentary and musculoskeletal system. So now I'm going to inspect your upper extremities. So there is no involuntary movement, and there is hands is symmetrical, and symmetric hair is evenly distributed, and okay, no cyanosis. So now I'm going to palpate, and let me know if there's any pain. Okay, is there any pain?
No.
Okay, no sweating, no tenderness, no pain, and no edema. So now that's your so now I'm going to that's the upper extremity. So now we are going to test the range of motion. So if you are going to follow me, we are going to start with the finger. So it's flexion, extension, and now we are going to do the wrist. So we can move this one with the flexion, extension. Okay, and we are going to do the ulnar and radial deviation. So radial and deviation, and let me know if you feel any pain. Okay, so we are going to doing the elbow. So it's flexion, extension, and now we are going to do the supination and pronation. So pronation, supination, pronation and supination. Okay, thank you. Now we are going to do the shoulder. So if you can shrug your shoulder, and we are going to do the abduction and adduction. So abduction, adduction, and we are going to do the internal and external rotation. So internal, external. Okay, so is there any pain?
No.
So no pain, and no no cryptus, and no altered range of motion. So now I'm going to palpate your radial pulse. Can you give me your hand? Okay. So pulse is strong and regular in rhythm. So now, can you grab my hands and squish my both hands? Doing your both hand. So the hands is strong and can squish equally. So now I'm going to inspect your lower extremities. So it's okay. You can just put it down. Legs are symmetrical. No voluntary movement. No physical deformities, and legs are symmetrical. No lesion. No deformities, and no no scars. Okay, so now I'm going to palpate. So if you can put your feet down, let me know if there's any pain. Okay,
No.
is there any pain?
No.
Okay, no pain, no sweat. Legs are warm to touch, and no tenderness. Okay, so now I'm going to inspect your thorax. So if you can turn around. So I'm going to inspect your thorax. So no cyanosis, no skeletal deformities, no cyanosis, no scar, no swelling, and APT ratio is 1:2. And now I'm going to palpate your thorax. So if you can can you move a little? If sit properly, and then if you can breathe while I'm palpating. Is there any pain?
No.
Okay. So no pain, and it's warm to touch, and no sweat. So now I'm going to palpate for the tactile. Palpate for the tactile fremitus. So if you can cross your hand, and then say 99 while I'm doing while I'm palpating. Okay, say 99.
99. 99. 99. 99.
Okay, so it's now I going to do the symmetrical symmetrical expansion. So while I'll pay the textile fremitus, there is no pain. So now I'm going to do the symmetrical expansion. So I'm going to grab this one and let me know if there is any pain.
No.
Okay, so no pain.
No.
And it's normal. So now I'm going to percuss so I'm going to percuss. So if you can just cover around in here, I'm going to percuss your thorax. Okay. To see.
No. 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 No.
Okay, so tympanic sound is found. Resonant sounds from the thorax. Okay, so now I'm going to auscultate your posterior thorax. So I'm going to auscultate the bronchovascular. Okay, that's the bronchovascular. Oh, the sound is loud, no extruder. So now I'm going to auscultate the vesicular breath. So can you breathe? Sound is softer. Okay, so now I'm going to auscultate all your your posterior thorax. So if you can deep breathe. So no crackles and whizzing sound. There is a good air entry in all lobes. So now I'm going to, if you can turn around, so I'm going to do thorax vascular. So you face it in the camera so we can see in the camera. So now I'm going to auscultate the aortic one, which is in the first intercostal valve, which is in the right side is here. Okay, that's the first intercostal space. So if you can breathe. And now I'm going to do the pulmonary, okay, which is in the left second intercostal space. And now I'm going to do the tricuspid in the third intercostal space. And now I'm going to do the herb point, which is in the fourth intercostal space, and the mitral, which is in the fifth intercostal space. Okay, so now I'm going to auscultate for the S1. S1 louder at the apex of the heart, and the S2 is best at the base of the heart, and apical heart is irregular and is strong. And I'm going to hear for the sound of S3 and S4. No abnormal sound and no murmur detected. So now I'm going to inspect your abdomen. So if you can lie down in here. Just put this one here so I can hear. So like you can lie down. So I lie down. I will use this one to cover your tummy. Okay, so abdomen is flat. No umbilical cord is not protruding. And now I'm going to where I am now. And there's no lesion, no scar. And now I'm going to auscultate the four quadrant of the heart, of the abdomen. The four quadrant is start in the right left quadrant, going to the upper right quadrant. It's going clockwise, so it's the left upper quadrant, and then going to the lower left quadrant. So there is no bowel movement sound detected. So I'm going to palpitate your four quadrant. So now cover it, and now I'm going to palpitate. So let me know if there's any pain.
No.
Okay, so there's no pain and no. Okay, so now I'm going to check. I'm going to auscultate for the Broid sound. So I'm going to check for the aortic. I'm going to check for the aortic sound. So it's so I'm going to use the small bell. Okay, now I'm going to check for the renal. And now it's the iliac. And now it's the femora. Okay, no broid sound is normal, and no broid sound. No broid sound. Now I'm going to percuss the abdomen and all four quadrant. So I'm going to percuss. I'm going to percuss. Is there?
No.
Okay. So tympanic sound can be heard, and now I'm going to palpate all the four quadrant and let me know if there's any pain. Is there any pain?
No.
Okay. So there is no pain and no tenderness, and now I'm going to check for the Morphy sign. So I'm going to put my finger and push in here and let me know if they're under your ribs.
No.
Take a deep breath. Tell me if there is any pain.
No.
So now I'm going to curl my finger and let me know if there's any pain.
No.
No. Okay. So there's no pain. So I'm going to. Okay. So if you can sit down. So we're going to check for rebound and tenderness. So if you are for us a Bloomberg sign, so if you can give me your hand and close your eyes and let me know if this is up or down. Okay.
Up. Down.
Okay. So is there any pain?
No.
Okay, so there's no pain, and when I'm looking at the client's face, there is no sign of pain. So okay, so now I'm going to perform the neuromuscular function. So I will the sensation of the arms. So you still close your eyes and let me know if this is dull or sharp. Can you? I have the your hand. So it's in the arm
Sharp.
and the hand
Sharp.
and the legs.
Sharp.
Okay, sharp or dull?
Sharp.
Okay, so now I'm going to ask you, I give you a cotton balls and see if it's and now I'm going to give you something and let me know if it's how it feels.
Soft.
Okay, so okay, and now I'm going to check the stereognosis and let me know if I give you something and tell me what it is. Okay, close your eyes and what is that?
It's a coin.
Okay, that's good. Thank you. And now I'm going to access the tendon reflex. So you can all. So I'm going to. Okay, do the bicep. Okay, it's 3, and do the tricep. Okay, that's 3, and the brachial radial. That's 2. Now I'm going to do the patellar. Can you? Okay, that's the 3. And the Achilles and your heels. Oh, that's 4. And now I'm going to do the plantar. So if you can give me your feet. Take off your. Okay, so the toes are curling when I'm doing the plantar. Okay, so now I'm going to wash my hand. Okay. So now we are going to assess the neuromuscular function. So if you can walk on your heel, walk in your heel, that's 2. Okay, and you can walk on your 2, and okay, that's good. So if you can just stand, close your feet. We are going to do the Drumber's test, and then close your eyes. Close your eyes. Okay, client. Can do the Drumber's test. Good. So I think that's everything. Okay, thank you.